Hello everyone, myself Queen Bhuya, a student of Lakhimpur College of Veterinary Science, shall be discussing today on the topic Abomasal Displacement. Now before I begin, this is a disclaimer that this is prepared to provide as much accurate information as possible. However, no information of this presentation should be considered for scientific work without cross-verifying the information. This is strictly for educational purpose and not for commercial use. Further, the information given in the presentation should not be used for the treatment without consulting registered practitioner. Now let's move forward and firstly the introduction. It is a common disorder of high producing dairy cattle. It occurs because the abomasum is suspended loosely by greater omentum and lesser omentum. The abomasum is shifted from its normal position to left displacement or to right displacement over a relatively short period. The left displacement of abomasum is gas-filled displacement of abomasum, which is distended to the left side of the abomasum, trapping in between the rumen and the abdominal wall. And the right displaced abomasum is displacement of the gas-filled distended abomasum from the ventral abdominal wall into the craniodorsal right abdominal cavity. Now, the epidemiology. The left displacement of abomasum is more common than the right displacement of abomasum. 10% of the cases are of right displacement of abomasum and the rest 90% are of left displacement of abomasum. The right displacement of abomasum is found in bulls and young cattle, which is much more frequent than the left displacement of abomasum, and it occurs within 3 to 6 weeks after calving. And the left displacement of abomasum occurs within first 6 weeks of calving and commonly in animals of 4 to 6 weeks of age. The condition is higher during winter months and rare in bulls and heifer, and it is common in high protein feeding animals. Now, what is the etiology? The main cause of displacement of abomasum is the abomasal atony, and this may cause due to high grain feeding or low roughage diets. The hypocalcemia due to various diseases like metritis, retained placenta may also cause abomasal atony. Electrolyte disturbances and lack of exercise and confinement may also cause abomasal atony and leading to displacement of abomasum. In high-producing dairy cattle, as there is large abdominal cavities, there is more room for displacement, which cause more displacement of abomasum in this kind of breeds. In this picture here, the figure 1 is showing the right view of normal bovine stomach, and in figure 2, the normal location of abomasum is showing. Now, what is the pathogenesis of displacement of abomasum? It primarily due to abomasal hypomotility and gas production. Abomasum is displaced upward along left abdominal wall and lateral to the rumen. Fundus and greater curvature of abomasum are displaced, which is in turn causes displacement of pylorus and duodenum. The omasum, reticulum and liver are also rotated in varying extents. The rupture of attachment of greater omentum to abomasum occurs during this phenomenon. Compression of rumen causes reduced volumes of organs and interferes with normal movements of the gastrointestinal tract. The interference with normal functioning of esophageal groove due to rotation of all stomach in a clockwise direction causes impeded forward passage of digesta. Partial obstruction of displaced segment. Although the segment contains gas and fluid, a certain amount is still able to escape and distension rarely becomes severe. The blood supply to the trapped portion is not affected. Displacement interferes with digestion and passage of ingesta, which leads to decreased appetite and dehydration. Here, the left abdominal viscera of cow. In figure A, the normal topography of left abdominal viscera of cow is given, and in the figure B, the left displacement of abomasum is shown. Here, as in the picture, the normal abomasum, which is normally on the right side of rumen, is shifted on the displaced to the left of rumen, causing left displacement of abomasum. Now, what are the clinical signs and symptoms of displacement of abomasum? There will be anorexia, weight loss, decreased milk production, ketosis, scant stool, and the displaced abomasum may cause left-sided abdomen or sunken abdomen. In left paralumbar fossa, characteristic pink sound on auscultation may be heard, and splashing sound during swinging auscultation may be heard. Here it is a picture for the pink outlined in a cow with an left displacement of abomasum. The pink sound in left displacement of abomasum is most commonly located in an area between ribs 9 and the 13, in the middle to upper third of left abdomen. And the pink sound in right displacement of abomasum is most commonly located in area between ribs 10 and 13 on the right abdomen. Now, how can we diagnose the displacement of abomasum? Firstly, we should learn about the history and clinical signs. Auscultation and percussion should be done for the characteristic pink sounds. Rectal examination should be carried out. Lipstick test can be done as a confirmatory test to distinguish between aruminal and abomasal pink. Use of stomach tube can also be done to diagnose displacement of abomasum. There will be increased PEC cell volume and hemoglobin. In most cases, mild metabolic alkalosis, hypochloremia, and hypokalemia may be seen. There will be slight decrease in blood calcium level. The condition should be differentially diagnosed with primary ketosis, traumatic reticulopericarditis, vagus indigestion, diaphragmatic hernia, ruminal tympani, as all these diseases have similar signs and symptoms with displacement of abomasum. Now, how can we treat the displacement of abomasum? The main aim is to return the abomasum to its normal position so that the normal digestive function can be restored. The sooner it is accomplished, the quicker the cow will return to normal and milk production and regain normal energy balance. For left displacement of abomasum, medical or surgical treatment can be successful, and for right displacement of abomasum, it requires immediate surgical treatment. As conservative approaches, calcium, neostigmine, and saline cataracts may be used. Mechanical repositioning with or without concurrent drug therapy may be done. Ringes or equivalent balanced electrolyte solution as fluid therapy can be used for treatment of displacement of abomasum. Rolling of cows can be done for mechanical repositioning of the abomasum, and surgically by right paramedian abomasopexy and right paralumbar fossa omentopexy, the treatment can be carried out. Here the picture is showing the casting and rolling of cattle for the treatment of left displacement of abomasum. Lastly, the prevention and control. The dry cows should be kept separately from lactating cows for proper feed supplementation. Roughage diets for dry cows should be given. Large quantities of forage should be fed during the late pregnancy. We should encourage exercise in heavy breeds. Amount of grains and corn silage fed prepartum should be kept at a minimum level. Steep or slippery ramps in milking parlors should be avoided to prevent the risk of falling and causing displacement of abomasum. So thank you for listening to my presentation. I hope all of you will like the video. Thank you.